The current standard of care for patients after initial therapy, when folks receive combination chemotherapy as induction and then transplant, is to then proceed with maintenance. In the U.S., maintenance is most frequently lenalidomide. And it is given indefinitely until progression. This differs from the European approach, where it's given for a fixed duration of 2 years. The question asked here is, if someone has MRD negativity, meaning they have no evidence of microscopic myeloma in the marrow at a level of 10 to the minus 5 to 10 to the minus 6, in a durable fashion, so for 3 years, can the lenalidomide be safely discontinued, and will the patients do well? The reason for doing that is both to address, mitigate some of the chronic, tolerable yet tolerable side effects that do affect quality of life in our patients, and to evaluate and also to mitigate some of the financial toxicity, of course, of giving long-standing chronic lenalidomide maintenance. So approximately 25 patients were enrolled on this study in the first, and this is a 2-stage design, with the primary endpoint of MRD recurrence at 12 months off of maintenance, with monitoring for MRD every 6 months by bone marrow assessment. And the outcome that will be presented as an oral abstract later is essentially that the majority of patients did not have MRD recurrence at the 12-month incidence. There were 3 events, in which case patients could resume the lenalidomide maintenance. And additional quality of life data will also be presented as well.